Hello, everybody. I'm very happy to be here and to present to you my company, Aqua Heart. We are developing a novel system for the treatment of atrial fibrillation with pulmonary vein ablation. We're doing this on the basis of the money that we have raised so far, $7 million. And we're introducing an A-round raise of $15 million that is launching in Q4 for the completion of the first in-human study in 2024. My name is Holger Friedrich. I'm the CEO of the company. The problem of atrial fibrillation affects 100 million people in the world. And it is the #1 cause of stroke. And despite spending $8 billion already annually on the treatment of atrial fibrillation, only 1 million people receive ablation therapy. And there has been a paradigm shift in the last couple of years. The accepted first-line therapy for pulmonary vein, accepted first-line therapy for atrial fibrillation treatment is pulmonary vein isolation and nothing else. And Aqua Heart technology offers exactly an easy-to-use, safe, effective, and very efficient solution for this goal, and we believe that with our distinct ablation lines, we can be even more successful than other ablation modalities. We are really, in this sense, a single-purpose company. We are just the screwdriver to fix screws. We are the company that fixes pulmonary veins in atrial fibrillation cases. Our solution is a steam-based double balloon system. So we are a single-shot ablation system. We can, during the ablation, monitor the pulmonary vein signals. So we have a real-time pulmonary vein signal monitoring, and steam as an entity of energy creation is extremely high, has an extremely high energy content, and so that enables us to do this complete ablation in under 10 seconds. That is what we call first-line therapy made easy, circumferential transmural in under 10 seconds. If you look at the market opportunity, as I mentioned earlier, we have currently a market of about $8 billion in ablation therapy. About 1/4 of this $8 billion is what we call single-shot ablation. The rest is other catheter designs. But remember that nearly all ablations have to start with a PV isolation. So we believe with our solution, we can grab a very significant part of this quarter, and B, we can probably even grow that quarter, and C, we hopefully can grow the bubble overall. We have done several animal series, of course, and we have repetitively seen some very favorable results. You can see here that the laser does not work. You can see that the laser doesn't work, but you see this very distinct ablation lines with only very minimal border zones. This is really, compared to other energy applications, very special, and leads us to the belief that we can be more successful in the long-term outcome of these ablation procedures. I would like to draw your attention to these white lines on the ECG on the right-hand side. This is our real-time ECG monitoring of pulmonary vein signals. So when I click here this button, the ablation is starting in the lab, and you can see that in this particular case, the signals disappear within, I think, 6 seconds in this case. So this is what our tool can do in a single application, complete ablation of the pulmonary vein. We have not seen any safety concerns, and we believe that the customer, of course, has to be enabled to operate on more patients. We have to enable more cardiologists to do these procedures. That's why we are proposing a very simple solution. We have an over-the-wire deployable balloon catheter. We have a generator that is fully automated and that gives the operator a very easy access to the therapy. That's really a true one-button operation for the operator. Because of our real-time PV signal monitoring, we do not need 3D mapping systems, which are additional costs for the lab and additional time consumed for the procedures done. We believe that with taking all together, that we can cut down the procedural times for an ablation to about 30 minutes. Now, what have we accomplished so far? I want to point out that we have a very broad and robust IP protection globally. We have in all the relevant geographies currently about 58 assets. They are concerning the general idea of tissue ablation with steam, but also special technological details of our catheter and generator system. We have the prototypes completed. We are in the final refinement stage and running the chronic animal study towards the end of this year. And we're then in a stage where we can prepare our first-in-human study. If you look at the history of ablation, then of course radiofrequency ablation was the first introduction to that completely novel therapy in the 80s. It's still the mostly used energy source. However, there are some shortcomings, especially it takes a lot of skill, it takes a lot of time. Procedural times of 2 to 3 hours are not rare. Cryoablation in the early 2000s brought the next step towards single-shot ablation. However, cryo also has limitations for the timing that it takes to ablate, but also some safety concerns. In the last few years, PFA has been extremely hyped, and we believe that PFA has solved many problems that RF was carrying. So we would say that PFA is probably the better RF, but the best of all worlds is our single-shot, ultra-short, high-safety profile, easy to use steam tool, and the real-time signal monitoring can guide the ablation. So we are the simplest, the fastest, and the safest pulmonary vein ablation tool available. Let me just briefly introduce my colleagues from the board. Eric Fain, the former group president for St. Jude, is the chairman of the board. Professor Sharma has invented the technology, and I'm very happy to have my friend Andrea Biffi here in the audience, our board member, very successful entrepreneur and businessman from Italy. And our team is very lean. We are relying on contract engineering, contract manufacturing houses, and we have in-house engineering and financial competence to manage that. Our scientific advisory board is spearheaded by Professor Vivek Reddy from New York and Professor Peter Neugel from Prague, very accomplished and world-renowned scientists in this area. I think probably the best that you can find. In summary, ladies and gentlemen, I would like to say that we have a very strong IP-covered proprietary ablation technology. We have a very experienced team. We have the potential to combine the benefits of speed, safety, effectiveness of PFA and the advantage of a true single-shot procedure with real-time PV signal monitoring. And currently, we're financed through our chronic animal study. We're looking to raise 15 million for the completion of our first-in-human study in a Series A. Thank you very much.